In this video, we're going to talk about ventilation-perfusion matching, and we have these three outcomes to help us get there. So we've talked about this previously, but just a quick reminder that the amount of oxygen or carbon dioxide will determine whether or not specific locations in the body or specific, tubes, for lack of a better term, either dilate or constrict. So as you can see, that when it comes to the bronchioles and the pulmonary or the systemic arterioles, they follow the same kind of pathway. If there is low CO2 or high oxygen, they'll constrict. If there's high CO2 or low oxygen, they'll dilate. However, pulmonary arterioles act the opposite. We're going to talk about why in a minute. But with pulmonary arterioles, they'll dilate if oxygen is high or if CO2 is low, and then they'll constrict in the opposite situations. So this leads us to local ventilation-perfusion matching. What we're talking about here is what's going on with specific pulmonary arterioles that go to specific alveoli. Okay, and so we need to remember ventilation is just talking about airflow. Perfusion, on the other hand, is talking about blood flow. So in a perfect world, we're going to send blood to where there is air so we can pick up oxygen and get rid of CO2. The ratio between ventilation and perfusion is called VQ, or ventilation-perfusion matching. So, first example. So let's say that we have an area or an alveoli that has a low amount of ventilation. Okay, and we can see that with this alveoli over here on the right. Okay, and so the oxygen in that alveoli is relatively low. What do you think is going to happen to this arteriole here? Okay, remember, the job of the arteriole is to send blood to pick up oxygen. So if there's low oxygen in that arteriole, we don't want to send blood there. And so as a result, that pulmonary arteriole will constrict. Okay, and that way blood flow is diverted to other places in the lungs that have better ventilation. This allows us to match ventilation and perfusion. So the second example is something called a shunt. Okay, and this is where we have a low VQ ratio. Okay, meaning there's very little ventilation, so similar to our last example, but in this case, for whatever reason, the pulmonary arteriole is not constricting. Okay, another way to look at this, we're sending blood flow to an area where there is low ventilation or there's low oxygen. Shunt is one of two types of mismatched ventilation perfusion. And so ultimately, here are the three conditions that we can have, at least as we keep it very simple. Okay, we can have shunt, we can have matched, and we can have dead space. Okay, and with each of these, we're just looking at ratios. We're not worried about exact amounts. And so think about it as in a binary. Do I have ventilation or not? Do I have perfusion or not? So with shunt, I have no ventilation, but I have perfusion. So my ratio would be 0 divided by 1, which is 0, or very, very, very low. Okay. With matched ventilation perfusion, seen here, I've got ventilation, I've got perfusion, my ratio is 1. And then here, where I've got dead space, I'm actually going to have a really high VQ ratio. If it's 1 over 0, it's undefined, right? But if that's 1 divided by, just think of a very small number, that's going to be relatively large. Okay, and so dead space is here, where I've got ventilation, but notice there's no blood flow there. Ultimately, this helps lead to our partial pressure gradients, right? If we send blood to where there's no oxygen, that means the oxygen that returns back to the heart is going to have low oxygen. It's going to reduce how much oxygen ultimately gets sent out to the rest of my body. Okay, in the alveoli, partial pressure of oxygen is about 104. The amount of oxygen that reaches the arterial blood is about 100. Okay, and if we do the same thing for carbon dioxide, blood that's in the alveoli, or carbon dioxide that's in the alveoli is about 40, and the arteries is about 40. We have better diffusion, which we've talked about, of carbon dioxide than we do of oxygen. Remember that blood that leaves the pulmonary capillaries is hopefully going to have high oxygen and low carbon dioxide. This leads us to cellular respiration. Cellular respiration will play a big role in the amount of oxygen and CO2 in the bloodstream. So if you have high cellular respiration, meaning you're generating a lot of ATP, you're going to be using a lot of oxygen. And so as a result, your venous oxygen is going to fall below 40. And you're going to have high carbon dioxide, meaning your carbon dioxide will likely be above 45. This will lead to an increased gradient, which is actually a really good thing because it's going to make it easier for oxygen and carbon dioxide to get in and out of the bloodstream. And then the opposite is true if I have low cellular respiration. I'm not going to be taking up as much oxygen. I'm not going to be producing as much CO2. The gradient's going to be smaller, which means less exchange is going to occur, but that's okay because I'm not using as much or producing as much. Okay, but we ultimately want these gradients. We've talked about gradients all semester. We'll continue to talk about gradients because without gradients, we don't have flow. And without flow, bad things happen. So at the end of this video, can you define shunt and dead space and describe how each of these occurs? Can you list the typical values of arterial and alveolar oxygen and carbon dioxide? And can you explain how cellular respiration affects oxygen and carbon dioxide concentrations?